Welcome to today's virtual town hall on the future of public transit after COVID-19. Today, swiftly, with the support from Spur and facilitation by Senator Scott Wiener, is presenting this webinar to share information and answer questions. We are at a time of great difficulty. We have a health crisis and a financial crisis. It has hit us suddenly and with great force. It will continue to affect all aspects of our lives, including, of course, transportation. Today, we are here to talk about the future of public transit. Crisis is unfortunate, but it brings in both a need and an opportunity for change. This is an Apollo 13 moment for transit, where famously the NASA flight director said, "Failure is not an option." We are fortunate to have here today some of the key doers, the change agents of Bay Area transportation. And we will first do short introductions, and then we will have a roundtable discussion with a series of questions, and these questions will be facilitated by Senator Scott Wiener. And first, to the introductions, and I will start. I'm Michael Smith. I'm a co-founder of Swiftly, a public transportation data company. We work with over 70 transit agencies to improve public transportation through the use of data, using new tools and ideas. I've been a public transportation professional for over 20 years, working with well over 100 agencies. Originally, I started as an advocate. I was a founder of Walk San Francisco, the pedestrian safety and advocacy organization. The goal was to help people most at risk. And then I led the creation of the Next Bus system, which in San Francisco is called the Next Muni system. And for the last 7 years, I've been part of Swiftly. My motivation has always been to improve transportation, but from a point of view of people, safety, and livability. My goal is to get people to their jobs, food, family, and opportunities. And by people, I mean everyone, not just some. I believe that technology is never an end in itself, but a means to an end, which is providing safe and effective mobility. And Senator Scott Wiener, please introduce yourself.
Hi, everyone. My name is Scott Weiner. I have the honor of representing San Francisco and Northern San Mateo County in the California State Senate. Before that, I was a member of the San Francisco Board of Supervisors and chaired our County Transportation Authority. I've done a lot of work over time on transportation policy and funding, and I represent a district that is very heavily impacted, or I should say, very heavily served by public transportation with Muni and BART and Caltrain and Samtrans and Golden Gate Transit and so on and so forth. And really thrilled to be here today and to help facilitate this important conversation about the future of public transportation. We are really at a crossroads about what the future of transit is going to be. And in my personal view, we need to recommit ourselves to making sure that transit continues to exist and thrive, and that we debunk some of the stereotypes about COVID and transit, and that we recommit to funding these systems that are in pretty desperate shape right now. We have an all-star cast with us today, an amazing panel, and thank you, Mike and Swiftly, for working with us to set this up and to promote it. We're really deeply appreciative. So we have some amazing people, and I'm going to let them each just say a few words to introduce themselves, and then I'll have some questions for them so we can really delve into their wisdom about where we are and what we need to do. So we'll start with Jeff Tomlin. Jeff, if you could introduce yourself.
Yes, good evening. I'm Jeff Tomlin. I'm the Executive Director of the San Francisco Municipal Transportation Agency. We design and manage the streets of San Francisco for the public good.
Wonderful. And next we have Latifa Simon, who's the President of the Board of Directors of BART. Latifa.
Sorry about that. I think you introduced me just fine. So great to be here and really looking forward to this conversation.
Great. And next, this is not just a Bay Area issue. This is in various parts of the state, and we don't want to be Bay Area centric, as the Bay Area sometimes is. So we do have some great representation from Los Angeles as well, including Tamika Butler, who's the Director of Planning at Tool Design. But Tamika has had many other leadership hats on transit issues over the years. So Tamika, thank you for being here.
Thanks for having me, Senator, and thanks for Swiftly and Spur for pulling this cool crew together. I'm just excited to be a part of this. I work at Tool Design, a private consulting firm where I'm our Director of California Planning and also our Director of Equity and Inclusion. And the Bay is near and dear to my heart. It's where I started my professional career as a civil rights lawyer in Bayview Hunters Point and Fillmore, the Western Addition. And so I still rep the Bay pretty hard.
Wonderful. Thank you, Tamika. Next is Jillian Gillette. And in full disclosure, when I was for my first year, when I was a brand new member of the San Francisco Board of Supervisors, Jillian was my chief of staff, and she's gone on to do some other amazing things. So Jillian.
Hi, thank you, Senator, or I guess Scott. I'm Jillian Gillette. I was recruited by Caltrans to stand up an integrated mobility program for Caltrans, riffing off of the 2018 California State Rail Plan. So my job is to work on integrating mobility in California, starting with transit and starting with transit trip planning and payment. And I'm delighted to be here. Thank you for this opportunity. And thanks to Swiftly and Spur and the rest of the crew. Thanks.
Thank you, Jillian. And then finally, Alyssa Walker, who is the urbanism editor at Curbed. And there's only there's a small subset of writers and reporters who really do an amazing job reporting on these issues of transit, housing, urbanism, and Alyssa is one of them. So Alyssa, thank you for being here.
Thank you. That's a wonderful introduction. I'm very happy to be here. I'm also based in LA, so I don't have too many ties to the Bay Area, but I do like it. And I hope to go there again someday soon.
Awesome. Welcome. So as you can see, we have a really amazing panel here. And so I have some questions, and I'll direct them to the people who seem most relevant, but other panelists, feel free to jump in if you have something to say. So the first question I want to direct, we have two people here for the two largest transit systems in the Bay Area and two of the largest transit systems in the country, who are really at the heart of what is happening and feeling the pain at the moment on the front lines. And that is Jeff Tomlin, who's the San Francisco Director of Transportation, which is Muni and our biking and walking and our cab system and so on and so forth, but most particularly Muni. And Latifa Simon, who is president of the BART Board of Directors. And so Latifa and Jeff, if you could just sort of give us a little overview about where the systems are, what you're doing right now, and how you see this playing out going forward, and how we're going to make sure that Muni and BART continue to be the awesome, expansive, successful systems that they are.
Sure, Jeff, go ahead. I'll go after.
Okay, well, so I started this job in late December of last year, which seems like 15 years ago. And about a month into the job, the first COVID case was found here in the United States. And a month later, the mayor issued her emergency order. And a month after that was shelter in place. And since then, our primary focus has been protecting the health and safety of our workforce and of the public. And thanks to the quick action by Mayor London Breed and the health directors of all the Bay Area counties, we are probably having the lowest COVID transmission rate of any large transit agency in the United States. We've been incredibly fortunate, particularly compared to our counterparts in cities like New Orleans or Detroit, and especially New York, which has just been crushing. So, so we have had a big focus on protecting health, and that has meant that we, in early April, having almost 40% of our frontline workforce out on COVID-related leave. That meant we had a weekend to completely restructure the entire transit system. I had the deep pain of eliminating 3/4 of Muni lines in one weekend and throwing all of our resources at the 13 lines that carried our greatest number of riders, that served all of our hospitals and other critical institutions, and that provided the most possible service to the neighborhoods where people had the fewest choices. We're now in the recovery period, but of course, all of our sources of revenue are down by mostly 80 to 100%. Muni is heavily funded by parking fees, which are down to zero, by transit fares, which are effectively down to zero, and a variety of other sources of revenue, like the hotel tax, which is down to nearly zero. So it will be years before Muni is fully operational again, given the severity of the financial catastrophe that is following the health catastrophe. The CARES Act has helped a lot. It has helped us to avoid catastrophic layoffs, at least for this fiscal year, and hopefully next, but it will mean a big contraction of service. At the same time, we know we play an absolutely essential role in supporting the economic recovery. Economic recovery cannot happen without transit. We are already starting to see a resurgence of congestion, and we're expecting, if we follow the trajectory of East Asian cities, by August, the Bay Area is going to be experiencing a catastrophic level of traffic congestion that will cut the ability of the transportation system to move people in half. And if people retreat in a fear-based way to driving, that will be the primary obstacle to additional economic recovery in our region. And so we are collaborating with our partners at BART and other agencies to figure out how can we deliver service, and more importantly, make our passengers feel safe on transit. When we know that while the health science from cities like Taipei is clear that public transit presents a very, very low risk of transmission, people make their decisions not based on health science, but on their emotional reactions. So we're very much carrying the emotions of our passengers close to heart, and also the sheer exhaustion and trauma that our frontline workers have experienced these last couple of months. Our crews are exhausted, and this is still the very beginning of a long, slowly unfolding tragedy.
Yeah, and if I could just add one thing to what you just said, because a fight we've been fighting, we saw that because of the experience of New York City, which was very complicated in terms of delayed government response there, in terms of some of the massive economic and racial inequities in that city and among the boroughs, we saw a very, very bad outbreak. And I think there was some rear end covering going on and saying, oh, what's to blame is that New York City had density and had a subway. And so it plays into, frankly, centuries of demonization of cities as some sort of like cesspool of disease, and you get a lot of race and class issues in there and homophobia about what cities are and what transit is. And I think it's really important that we set the record straight about what the facts are. So that's my little editorializing.
Right, and the facts are clear that density is not the problem, nor is transit, right? I mean, like all of those assertions were rapidly debunked. The data is really obvious.
Yeah. Okay, Latifa. BART's starting to make a comeback. I saw the ridership is inching up now.
The ridership is inching up. Jeff, I just, first of all, I love your background, and it's nostalgic. My mother owned one car in my life, and I was born and raised in San Francisco, and it was a 1973 Maverick. So I spent most of my years on the 5 Fulton, the 31, and the 38. And I don't know what that is. It looks a little bit like one of the Fs. But so much of public transportation is deeply built into the daily lives experiences of folks in cities. And thank you for your words. And we mirror the same values at BART, maintaining our workforce. And before I kind of talk about some of the mirrored actions that we've taken, I think, Jeff, we can't understate that enough. Men and women and people are getting up at 3 and 4 o'clock in the morning, leaving their children and their elderly and their partners, and they're opening up our shops, they're opening up our stations, and they're ensuring during this pandemic that we're on time, that we're moving. And BART, as you all know, and with the expansion, will be about 130 miles of track now going through 5 counties in 2 weeks. The pandemic has been, it's been tragic for everyone and for all sectors. But for BART, you know, what's been interesting, similar to Muni, similar to other providers, so much of our operating, in fact, 70% of our operating comes from fare box, a combination of fare box and some parking and sales tax. And so we were losing about $9 million a week. And while the CARES Act gets us through this fiscal year, like Muni, like other operators, our commitment is to honor this workforce and to keep moving because, yeah, you're absolutely right. Even now, while we're about at a 94% flat rate. So we have 7-8% of our ridership, 6 to 8, kind of, you know, fluctuating. But I was out in the system this week visiting our new station, and the trains are a bit full. Or more full than they were three or 4 weeks ago. Folks are wearing face masks, folks are out. But here's where the pain starts. We have to think about not only keeping our system extremely clean, which it is, our workers are breaking their backs, ensuring that we're following not only the CDC standards, but the standards of our 5 counties and going above and beyond. We had to figure out how to get PPE for over 2,000 plus workers. We've shut down our headquarters. Many of our folks in the office are working at home, and I want to give them so much love because so much of what's happening is happening with folks who are, again, raising children and caring for their parents, and they're doing so along with our frontline workers with such grace. I think the future of transit, if we think about this moment, folks and leaders like Jeff and like yourselves, we'll talk about this later, we're going to have to fight like hell, not only for the ethos of public transit, but we know for many folks like myself who are transit dependent, who've never driven a car, not just because of circumstance, but because they are transit dependent, that we have to keep moving. Every day, 24,000 folks, even in this epidemic, are using Bay Area Rapid Transit to get to grocery, to get to the doctor's office, to get to work. And that, you know, so many experiences put people in transit. And the hardest thing we have to do, and I'll stop here, is every week look at the data. Our brilliant staff, our brilliant general manager, we're looking at data every week and making tough decisions. For folks who love transit like all of us, the worst thing that you could ever do is limit your offerings. So with losing all of this resource, and even with the CARES Act, we had to make some tough decisions to close our stations at 9 p.m. They're usually open to 12 a.m. That's difficult. But in the interim, while this is happening, we still have to keep our system safe. So our operations, in terms of all of our capital projects, we're moving full steam ahead, but it's hard. But I don't think there's no question that we have to keep moving.
Great. So Tamika, question for you. So if, given what Jeff was talking about, that you have people who are concerned about, you know, maybe do I want to take transit now? Maybe I'll drive instead. So people who have the choice to drive instead of transit, some may shift to do that. And that could lead to further segregation and of our transportation system, which can lead to, you know, create a lot of real challenges and inequities. And so I'm curious what your take is on what can we do? How can we avoid that? How can we respond to that? And, you know, make sure that transit continues to, it's a public good for everyone, and it works best when everyone's together.
Yeah, that's a great question. And you know, it falls into this trap that I'm a little worried we might fall into as we have these fears that transit ridership is going to fall, or we should say continue falling, right? For many of the systems, there's this desire to figure out, for those folks who don't have a choice, how do we get them to realize that this is a viable mode of transportation, that it's still safe, that they should still be on it. And while I think that's important, I still think that when we're thinking about how are we looking forward, and how are we reimagining and revisioning the future, not just rebuilding, not just going back to normal, because we should all be starting from a place that normal wasn't good enough. But as we are rebuilding and trying to go back, how do we not forget about those riders that are sometimes offensively called captive riders, right? Because the reality is there are people who don't have a choice. And so we can't, once we're trying to figure out, service and what happens next and what to do with our budgets, all of those things are about priorities. And we have to continue caring and centering those folks who don't have a choice. I think we want to, of course, think about congestion, and we all have had those moments where things seem dark and we don't know what's coming, but we notice that the air is a little cleaner. We notice that the birds are chirping a little bit more and that the flowers are beautiful. I mean, we all follow Jeff on Twitter. Like, the flowers are gorgeous, right? And so we know that the toll on our environment, and we know there have been all these benefits. And so we're going to want to figure out how to keep those folks who have the luxury and the privilege to make choices engaged in walking and biking and taking transit as they are now. And so, yes, we should do that, but we shouldn't be in such a rush to do that we forget the folks who are dependent on these public modes of transportation. And more than ever, those are our essential workers. We have deemed them essential, but for so long in society, we've forgotten about them. And we've put them to the side and we haven't cared. And so as we go forward, we have to say, what were the things that happened that were actually good, and how do we keep them? But we also have to say, even though these folks aren't wearing scrubs and going to the hospital every day, they're keeping us all sustained. They're keeping us all, and they're holding us all. And we might see it now, but they've always been holding us. And how do we continue to center them and the decisions and the priorities that we're making?
Yeah, it's a really excellent point. Thank you. When we have a crisis, we have opportunities to maybe do a little innovation and think differently as we come out of it. So, a question for Jillian and for Mike: what are some technological changes we can make to try to improve transit as it comes out? Maybe things that maybe we should have done before, but we got caught up in some inertia. But now everything's shaken up a little bit. We can make changes, and then also. In terms of like fare payment integration and streamlining, just wondering if you can think of some thoughts about some innovative new things we can try.
Sure. So thanks for the question. The pandemic hit us later than it did Asia and Europe, so we can look a little bit to see what's going on globally. And what we can see happening in Asia and Europe, so Asia, the transit ridership dropped off a lot less than it did here. And in Europe, also less than here. But they're going before us. And what the message from them is, simple is better. Make things as simple as possible. And, transit ridership was dropping before COVID, and we made a lot of investments, but they still weren't bringing transit ridership back. So simple was probably always something we should have, simplification was probably something we always should have been looking at, and now looking at it even more, given that, as Jeff mentioned earlier, there's, the safety issues on transit are overblown, but there's the perception of a safety issue, and we need to address that. And people have short attention spans. So anything that's overtly complicated is going to make them, less likely to use our service. So customer friendly is simple. Paying for transit should be as simple as buying a cup of coffee. It should be the costs associated with buying a cup of coffee. The transaction cost should be no more expensive than buying a cup of coffee. That's not true in transit. The dry cleaner only pays 3% in transaction fees. In transit, we pay a lot more for fare payment systems. And that's in areas where we're fortunate enough to have a fare payment system. California has we stopped counting in my program at 364. There are over 364 transit operators in California, and they're all making their own decisions about pretty much everything. And we have an embarrassment of riches in the Bay Area and Los Angeles, but pretty much all those other transit operators in the other part of the state don't have products that are being built for them. So simple is better. finding shared network services, doing what they do in Asia and Europe, and letting go of bespoke and custom products. I mean, we can just see that just last week, LA Metro abandoned a custom trip planner app that it had been working on for years in favor of the transit app. So I think we're going to see more of that, and that is an opportunity to make transit more appealing and more equitable.
Great, Mike?
Yeah, I'd say the biggest opportunity with respect to technology is the use of data to provide safer, more effective service. And so first, let me provide a bit of the context. Jeffrey Tomlin talked about this a little bit, but right now transit is facing a quadruple whammy. So there's actually 4 things going on at once. First of all, safety is now paramount for both passengers and operators. The second thing is that there's fewer operators available. Many of them have had to be quarantined. There's just not as many to operate the vehicles now. Same time, there's huge funding problems, and traffic congestion is going to increase. So everything is conspiring against transit, and we need to do more with less. It's absolutely critical that systems are well run efficiently with safety in mind. What used to just be a shortcoming of a system, like buses bunching together, resulting in big gaps in service, now is a health and safety issue. So for example, imagine a route where a bus is supposed to run every 10 minutes in order to provide some spacing for the passengers so they can be safe. If 2 buses bunch together, that means that there's a 20-minute gap. And that means that the passengers, there's going to be twice as many passengers on that bus, and they will not be able to safely distance themselves. And so bunching of buses now is a health and safety issue, and it's unacceptable. Another example is that service is going to change frequently, week by week, instead of once a year. Routes will be added, service will be increased, which is a really good thing. But at the same time, traffic is changing dynamically. Every week, traffic is going to be different. Everything is changing. So how can the agency know that they are scheduling service efficiently? Are the buses able to keep to their schedule? If not, the service is going to be haphazard and the buses will bunch together. Are the buses getting too much time to complete their routes? If they get too much time, it means that they're not running efficiently, and we're not running as much passenger service as we want to. And again, the buses would be more crowded with passengers, a health hazard. And so how can the agency optimize things for safety on a weekly instead of a yearly basis? How can they do things really quickly? And the answer is through data analytics tools that instantly provide them with needed information. Also, an agency needs really good real-time information on headway, on bunching, and more to effectively manage their system. Like agencies like the SFMTA, they have excellent people in operations, but we need to make sure that they have the right information and the right tool and processes so they can effectively manage their systems. So they need, in an instant, database insights on where problems are occurring, when they are occurring, and why they are occurring. So it's imperative that transit agencies obtain and use these tools. So another issue is that passengers, they need to know how crowded the next bus is going to be. If the arriving bus is going to be really crowded, then they will want to wait for the following bus. But currently, they don't have that information available. And so we need to make sure that passengers get that crowding type of information in real time from transit app or from any application that they're using to get their information. So we're going to see 5 years of change squeezed into just a few months here as we come out of this whole cycle. Before, it was prudent to make changes, it was prudent to change and carefully manage those changes, but it was all about being prudent. Now it is prudent to make the changes immediately. We don't have a choice. We have to make these changes quickly. We can't wait 5 or 10 years for new systems to be implemented. We can't succeed with 15, 20-year-old technology. We need flexible open data. We need powerful cloud-based computing instead of mainframe-based data silos. So we need tools that match the flexibility of all these changes that are being implemented. So we have good people at the transit agencies, but we need to provide them with the tools, the data analytics to make them more effective. And we must use this crisis to switch to new capabilities for better managing the system. Otherwise, there will not be a good future for transportation. So as I said in the introduction, failure is not an option.
Good. I like that attitude. Okay, so next, I have a question, I think for Alyssa and Tamika. And Tamika, I think you used to run the LA Bike Coalition, right? That's great. And so what are your predictions about how this pandemic, and as we move out of it, how active transportation, particularly biking and walking, is going to be impacted, or how it's going to change, what we can envision in the future? So yeah, Alyssa and Tamika.
Yeah, I'll let you start, Alyssa, jump into the conversation.
Mm-hmm.
Yeah. Well, we saw this week, did Jump leave? Jump Bike said they're closed or they're done. You know, we're starting to see all these, the micro-mobility. Imagine a year ago, we were talking about scooters like that. Also, that seems like 10 years ago that we were talking about scooters. But so we already have those options eliminated that people relied upon. We're lucky enough here in LA, our Metro bike system is integrated into our transit system. So it's part of Metro. So it gets subsidized the same way. It's been kept up the same way. It's been running the same way this whole time. And I think it really has proven that bike share can be this truly essential transportation for getting around. What we don't have here in LA, and what I would hope to see happen, is something like what's happened in San Francisco, where you've really tried to make sure those corridors are intact, to make sure people, if they wanted to switch to biking, if they wanted to switch to walking, that they feel like they can get around. We have a slow streets project starting, but it's more like little clusters, and the city is so big. So we're still not going to have that confidence for people who might, are not already make the switch. And we've heard these stories now that you can't even buy a bike. I mean, I keep hearing these stories of people trying to buy, especially inexpensive ones. I think you could very easily buy a $2,000 e-bike if you wanted to. But a lot of people who are wanting to make the switch, you're shaking your head, no, you can't even buy that. You're like, all sold out, all gone. But I think people who want to make the switch, there's no real choices here for people who might even want to try. They might not feel safe riding with cars, and they might not have an option for an affordable bike. This is what I would love to see coming out of this, is we're all going to throw out our dream ideas, is something like the e-bike credit that we've talked about at the state level, where some people are able to trade in their car and get an e-bike or credit or e-bike, or money to buy an e-bike. Let's try to do that for as many people, expand that program for as many people that want to do it. And if you have less money because you don't have a job due to the crisis, in LA, we have, I think 40% of workers are not working right now in LA, which is, half the city basically needs an affordable way to get around and safe way to get around. So what I'd like to see is really supporting those choices with some good incentive type programs at the state level.
Yeah, I totally agree. I think, we're in this space where, for those of us who are privileged enough to still have a job and perhaps not be as worried about our job, I think a lot of us feel that tension and that guilt of I still have this job, but I want to be helpful, and how can I be helpful? And I think I'm one of those people. I'm privileged to be at a private transportation firm that, specializes in walking and biking. And we're really busy right now because people are having to turn to walking and biking. And I think, as someone who used to run a bicycle coalition, as someone who is an avid cyclist, I'm pumped about that. I think what's interesting, one of my colleagues, Dr. Destiny Thomas, when this whole thing first started, she tweeted something out that said, I hear a lot of whispers about slow streets. I want to see how transformative it would be to give everyone who needs one a bike. And people came down on her. If people wanted a bike, they could get a bike. They'll be able to get a bike, but we have to jump on this opportunity to put infrastructure in place and start these systems. And so I think there is this frame around those of us in policymaking decisions about being opportunistic, and that just feels a little gross, right? Because even if we're opportunistic, and even if we have slow streets everywhere, you see us all shaking our heads how do you find a bike? And that's for people like me who are willing to throw money at anything to order it online and just like get it right now, right? And so what about the folks who can't do that, who are part of the digital divide, who don't have the same access to even being on this webinar, right? And so how do we make sure that as there's more political will for biking and walking, that we also have opportunities for folks who want to take part in active transportation to have access to the things they need to do that. And that might mean figuring out ways to get people bikes, but it also might mean figuring out infrastructure, figuring out making sure the sidewalks are great, making sure that we're able to address issues. If folks with disabilities might have, might not be able to put on a mask, and we say that's okay, but they still don't feel safe going outside because people keep yelling at them or because there's not enough room on the sidewalk. How do we build all of these things into place? And so I think we have to look at the political will. I think we have to look at the actual infrastructure and the actual thing like slow streets, where I think that some people think there's a critique against the intervention when what's actually happening is there's probably a little bit of critique around the process, and just the process being, how are we thinking about the things you need to do to make sure that the intervention can be used and can be enjoyed by everybody? And so again, political will, infrastructure, but then also just actually listening to people about what they need to be able to enjoy that space, because we know that some of the people on this panel have a very different experience going out for a jog than other people on this panel have a very different experience than trying to roll down the sidewalk or the closed slow street in their wheelchair, if they have a disability, if they're a trans person of color. And so all of those things have to be looked at together. And you asked a question about active transportation, but I think this is actually unveiling one of the biggest things we have to think about with this pandemic. We have to start thinking about all of these issues as interrelated. And it's been exciting at times to realize that for the first time in a long time, this is one of the times where you're having all of these people from different departments, from different agencies in the same room, and we can't lose that. Even if it's just how do we get more people on bikes, we can't lose that.
Great. And so you brought up or touched on one of my, I think another issue that I wanted to put out there. I was going to ask Jeff to comment on this, and Alyssa, and anyone else who wants to, about changes in our streets that are happening potentially temporarily now, but could some things be permanent. One of them is the slow streets movement, about closing off some streets to car traffic, and what that means for the future and what might be permanent, how we do it, how we make sure that it's equitable. But also, we know that with restaurants and bars and cafes who are going to be reopening with much constrained capacity. And so I know San Francisco, I think probably LA too, different cities are thinking of ways that we can expand sort of outdoor access by these restaurants, bars, cafes, not just sidewalk seating, but in parking spaces or in alleys adjacent or in parking lots, because it allows them more capacity. It's less risk because you're outside. And then in addition, ABC, and I really want to commend ABC, has done just a fantastic job, and Jacob Applesmith, its director, in immediately issuing orders for more flexibility for restaurants and bars to make them more viable. And they're looking at regulations to allow service where outside where you normally would not be able to serve, to try to increase viability. So between those two things, the more outdoor of the food and drink kind of coffee kind of situation, and then the different uses of public space, wondering if you can comment on how you see that playing out over time. So Jeff, I don't know if you want to start.
Yeah, I mean, it's been a remarkable period of time. I think it demonstrates that when government is clear about its mission, and when all of the pointless regulations and bureaucracy that were developed in the 1970s is swept away by the governor's order, that government can get shit done. And so cities like San Francisco and Oakland and Seattle and a variety of places around the world, we're creating quick build bikeways and massively traffic calm streets and restaurant streets. I mean, here in San Francisco, we're doing 20 blocks a week or more. I've got probably 20 pending discussions about closing entire blocks to have the entire street be restaurant tables that are being brought to us by merchants associations, things that would have been unthinkable 3 months ago. And we're just sweeping away all of our rules that had gotten in the way of progress because we're clear about what our values are, we're clear about what our mission is, and we know that the transportation system cannot recover until the business community recovers because we're dependent upon them for our resources. So there's a remarkable period of alignment here that is allowing us to demonstrate ideas that we've been talking about for 50 years. And the official line, of course, is these are, all temporary pilot projects. None of these is a project, they're all just concepts. But if the concept is successful, we will then go through the official bureaucratic nonsense that we have to in order to allow these experiments to be deemed actual projects. So, but to do that, we're going to need support from all of you.
Okay. Alyssa?
Yeah, I've been thinking a lot about this because I think today what they passed was that if you're a bar and you get a food vendor, you can open and be a bar that serves food magically as long as you have the right, social distancing policies. So my colleague, Farley Elliott at Eater was like, this means you turn your parking lot into a beer garden or something like that. And you could have this great opportunity for food trucks or street vendors to just come and serve at your venue, which I think is, for me, a big concern because what I saw here in LA is that street vendors were one of the first groups of businesses to be shut down for health and gathering reasons, like all these different concerns. And they don't really have a plan to be brought back yet, even though we're just already talking about expanding restaurants into the street and the sidewalks where they sell. And every day we have a guy that comes down our street and sells snacks and other things. He's got his little mobile cart and he's, people don't even have to leave their yards. They're just standing there, handing money over and he's giving them stuff. And I feel like that is kind of the businesses that we really need to support in this moment because they come to you, they're delivering things that are probably essential goods that you need to have. And then they can really play a role in this, in how we reactivate our streets and our sidewalks and make sure that we're making these bars in compliance with whatever new laws they're coming up with in the next few weeks. But I like the idea, but I hope we can do it in a way that we are making sure that our smallest entrepreneurs are also getting a cut.
Absolutely. The pioneers of food in public space, and they get mistreated and criminalized and everything else. So a question for Latifa and Jillian, and this is about funding. And, of course, transit is always under stress on funding, particularly systems. Muni is in a more privileged situation because it is, has a 28% or thereabouts fare box recovery. It's backed by the San Francisco General Fund. But when you have a BART or like a Caltrain where there is no general fund and it's so heavily dependent on fares. So between that, and then, of course, both the Bay Area and LA transit are very dependent on sales tax. And so, we'll see what happens with sales tax. But I'm just curious what your thoughts are about what it looks like and what we need to be doing federally at the state level, holding me accountable, and locally, regionally, in terms of long-term funding sustainability. So, Latifa? You're on mute, Latifa.
I am really showing that I'm really my grandmother's daughter. I really am. I'm so embarrassed about it. Senator, quickly, I really appreciate the question because for BART, the last 8 weeks have been just extremely devastating. And what it's brought to our attention is that we absolutely should be working with you and your colleagues at the state level. Although, again, our budget has been also savagely shifted, we have to think about a new algorithm for funding. You look at the revenue streams for New York's MTA, and I wish we had a similar balance sheet. Although they're struggling, their sources of funding are stronger and are not as reliant to fare box. Before this happened, and we talked about sales tax as well, sales tax for a quarter. We're not going to have parking taxes on parking or parking fees, sales tax for a quarter that could have gone to BART. We're not going to have. We're really nervous But we had, before, this moment, we were also worried about sustaining ridership. And I was also working with, members on this call and other folks in the community to think about ways that we could do things like make pilot BART free for teachers. I think that still needs to happen, and that we are going to find the resource to make it happen. It would be less than $2 million a year to pilot 5 counties and a select group of teachers from public schools who have over 50% reduced lunch, to get those teachers moving and get their kids on BART. When will that happen? I'm not sure, but I think that changing the conversation and understanding the importance of what transportation will not only mean in the recovery, but now, because in fact, we are talking about, our brothers and sisters and siblings who are dependent on transportation, folks who are in wheelchairs, folks who are visually impaired, folks who have motor disabilities, parents with numerous children, young people who are under the age of 18, who are still working in the service economy, who are at your in and out right now, and who need to work 9, sometimes 10 hours a day in a night shift. They're relying, not just in the cities, but in the suburbs, on rail and bus. And we absolutely need to look at those cross sections. And cutting service, I believe, moving forward, I think we're going to have to work with the state and the federal government to figure out different ways to fund public transportation. Fare box recovery in the next 2 years isn't going to be enough to sustain what we know is important. BART is running 10-car trains, even with the demise of ridership, because we understand how important it is to socially distance. We understand that people need to feel comfortable. Muni's doing very similar work in ensuring that folks can get on the back of the bus. So we still need to run at the same level, but again, with deeply reduced revenue sources. So we need you, Scott.
Great, we'll be there. Jillian.
I guess I would encourage a little bit of thinking also about making our case in a more data-driven way, sort of riffing a little bit on what Mike was saying, that one thing that transit has not really done is standardize. Most other industries have far more standards, and we really don't have that many. And so we should standardize and we should organize around data. But doing that, is expensive, right? The kind of people that work in data and technology typically are well paid. And so when you're talking about one state alone that has over 360 transit operators, does it make sense for all 360 plus of them to have these experts in each of these data-driven areas? It probably doesn't. I mean, my opinion is that we should really look into shared services at the right level. We see examples of shared services working in the larger urban areas, but again, if you're not lucky enough to be in the Bay Area or in the LA metro region, you basically fall off of all of the cliffs. So standardize, federate certain shared services, stop worshiping at the altar of process, stop worshiping at the altar of local control about everything, and invest in in-house technical, desperately needed in-house technical expertise at the right level so that it scales. And then I think from a regulatory standpoint, I think that we now have an extraordinary obligation and responsibility to really understand what resilience means. There's a lot of talk about, going back to normal. And, Tamika said normal wasn't good enough before. And I think our responsibility there is, this is not the first time and the only time that this kind of thing is going to happen to us. We still are going to have fires. We still are going to have earthquakes. And what is happening to us now demonstrates how fragile this system that we have is. It's not a network. It is 364 different agencies kind of doing their related stuff, and that is not resilient. Standards are a typical way to allow competition where competition is appropriate. But, you know, one of the great successes of the United States is that you can look on any baseboard in any building in the United States, and an outlet looks like an outlet everywhere in the United States. If you go to other countries, you can see examples where they couldn't agree about basic plumbing, like in the UK, and you see these different receptacles because they couldn't agree about stuff like that. Like, now is that moment in transit. And there are well-known global standards in payment and in data information. And it's probably time for us to stop fighting about them and not just adopt them, but actually do them, which is the case in other parts of the world.
Great. So I have a question for, I think it's probably good for Mike and Tamika. So talking about technology, and Mike, you talked about before about making sure people know, is the bus crowded, having that kind of data available and making it really seamless. The question is, how do we make sure that everyone actually has access to that data? Because of course, not everyone has a smartphone. Some people have smartphones, and like maybe he's watching now because he's a big social media person. My father, I've taught him probably 7 times how to call a rideshare. He still doesn't. He's good at commenting on social media. He's awesome at that. But for some reason, the calling the rideshare, it just hasn't gelled. And so there are people who, for many, many different reasons, either don't have the technology or they have it, and it's just not going to work for them to like quickly figure out, is this bus crowded or not crowded? Or so how do we make sure, and I guess you can also have, you know, boards that are available to the public, but what are your thoughts on making sure that as we improve the technology to make the transit experience better and safer and healthier, that it actually works for all of the riders and not just for a subset?
Yeah, so I'll go first on that. So I think you're completely right that we have to make sure that the information goes to all the riders. We should never be making decisions about who can access the information. And so that means it needs to be distributed in many different ways. And so, you know, one way is indeed smartphones. Most of the people do get their information on transit from smartphones. That's great for the people who have it, but it shows the importance of the electronic signs at the bus shelters, in San Francisco at least. Yes, they do cost a significant amount of money, but it allows everybody to get the information. They can get it at a glance. So currently, that information only displays when the next bus is going to arrive. So it should be modified to also display the crowdedness of the bus in a really simple way. Another way of getting the information out is through SMS and telephone systems. So someone might have an old flip phone and it suited them well for 10 years or something like that. They're not going to get a smartphone. They should still be able to get the information simply by sending a text message and getting the information on crowding as well as when the next bus is going to arrive. So I think the key thing is that if we have a standard ways, data standard formats for getting out the information, which we actually already do. The key thing is getting people to use them always. Then there's various clients that can use that information, and that will make it more accessible. So I think the first thing is to make sure that the information is going out in standard formats, and then it's to also make sure that there's various ways of everybody receiving that information.
Okay.
Yeah, I think all of those points are spot on. I think first you have to center the community needs first, and this is clearly a theme with me, but I think sometimes as agencies or as even private companies and planners, we go out and we say, here's what our goal is, so let's ask people about this. But we're only going out to find out what they think about what we want to do, not what they need. And so I think if we're going out to try to do something to improve transit, we first got to figure out what it is they need. And then when it comes to technology and when it comes to collecting data, I 100% agree with Mike. We have to communicate clearly and through appropriate channels about what we're gathering, be transparent about what it is, and then also how it's going to help them. What is the actual benefit to them? And not just this is how it's going to help us run our train smoother, but also how is this going to directly impact you, and how is it going to be useful to you? And I think something else Mike said is through appropriate channels. And so right now we're all trying to figure out how to do everything on Zoom, and we're wondering, like, what are we going to do if we can't meet people, you know, where they are? But there are groups like AARP who are working with older adults and doing these huge phone town halls, and that's how they're reaching people. Election folks have known for a long time about the digital and Wi-Fi gap in low-income communities of color, and so they are texting. They are doing other things that you can still do from an appropriate social distance. And I think we just have to acknowledge that whenever you're collecting data, there are risks and people have concerns about them. And instead of pretending like there aren't, we have to be honest about those risks, be transparent about them, and tell people how we plan to address them. And that's huge. And then I think last but not least, we have to be willing to be accountable. If something's not working, just be super accountable. And that means being open to feedback and being open when we do things wrong. But, you know, appropriate channels, texting people where they are at the shelters. Many communities might not have shelters. So do we also have to build the shelters? And then the last thing I'll say is actually on your last question about budget. I think it's important, and I think a refrain that we should all say, and I think we all know this because I know all of you and I know you care about this, but budgets are important. If we take nothing else from this, budgets are important. And that's something we're dealing with dearly right now in LA. And how do we, you know, maybe take money from policing and enforcement and put it in things like sanitation and level of service and keeping our drivers safe. And so budgets are our priorities and budgets are important.
Right. So Alyssa, a question for you in a more Gestalt urbanism theme. We've seen this like raging debate, all these articles in national and local papers, and the LA Times has been reporting on the New York Times, all over the place about, you know, the whole debate about did density cause COVID, you know, based really exclusively on New York City and ignoring like Taipei and Seoul. And the second densest city, San Francisco, where 36 people have died. That's 36 too many, but it's a lot less than some other cities, and so on and so forth. I don't have an opinion about this or anything. But this narrative that, oh my God, and I've gotten calls from reporters about this. Well, don't you think everyone's going to just like want to not live in cities anymore? No one's going to want to live in an apartment building. Everyone's going to have to, developers are telling me they're going to redesign all their buildings so that every unit has its own exit, so no one has to be in a hallway or an elevator, and no one's going to want to be on transit, even though they're going to Costco and the church, which are just as crowded. So I'm asking a loaded question, but like, what can you just talk about just your like take on, you know, especially once we get, hopefully, God willing, a vaccine and we're moving past this. Do you have what's your take on impacts on urbanism and where people are going to want to live and how they're going to want to travel?
Yeah, I do love those trend pieces where it's like everyone will have a veranda and a giant fridge to store their food because they don't know how when they'll be going to the store. I mean, it's just like that's for, or a room for they can work from home. And I mean, some people will probably do that. Those are the people who probably already left the city because they have their summer home somewhere else and they just got out of town as soon as they could. For the density thing, I always like to remind people, since we are a California-centric audience today, there is a San Francisco in the middle of LA. In the central LA area is exactly the density and population of San Francisco, just dropped into like, you know, the center of central LA, like downtown, Koreatown, Hollywood, like this little zone. So we actually have one of you here. And if the argument was about density or not, we're not doing as well as you at all. Like we are actually like still at like 50 deaths a day in LA County. And that's a huge area, of course, like it's the biggest, you know, it's a county that's bigger than like what, half states or something like that. You know, we have a lot of people, but in that one little area, we have people dying every day. So there's clearly a problem. And there's been so many things that people have talked about. We've talked about crowding. We've talked about air quality. We know that that is a really big problem, and our air was great for a few weeks, and then all of a sudden it hasn't been so good the last few weeks, even though people are still driving less. We know there are these disparities in our healthcare and the way people are living and the way people are getting around that are making them more susceptible, and particular groups for sure are in LA are going to keep dying unless we solve these problems. So as far as where people are going to choose to move or the living situation, a lot of people aren't going to have any choice, and they're going to probably have fewer choices because there's going to be people who are, like I said, that 40% unemployment right now that's happening. So this is again where we look at things like housing people in hotels, like the permanent housing options. If we could get people to, you know, who are on the streets or people who are homeless to be able to move into these hotels and semi-permanently or permanently, and make sure that we start to address some of those bigger issues where we can start to narrow that gap to make sure that people aren't more vulnerable just because of where they live in the state.
Yeah, and I think you also mentioned this, but the people say density and they group a lot of things in, but there's housing density and there's also housing crowding when you have a lot of people living in units because they can't afford housing. So thank you for that. So a question for Jeff and I think Latifa. So in terms of, and Jeff, you've talked about this some, in terms of getting riders and operators to feel safe on transit, and what needs to happen over time to give people that confidence. I know, Jeff, you talked about some of the studies. I know the rates of COVID and impacts on operators in Bay Area, New York City, I know is really just horrific. Just what do we need to do to get folks to feel safe, both from the operators and the riders?
Go first, Muni.
Go ahead. Wait, what? Okay, so two separate things simultaneously. One is the health science and being clear about what are all the risk factors, the mitigation factors, and the exposure rate. So in public transit, provided people are wearing face coverings and we make that mandatory, provided there is a lot of support around public transit and the theater of public temperature checking and lots of PSAs and providing people with face coverings, following what we're seeing in the East Asian democracies, particularly Taipei and Seoul, what is clear is that the transmission rate is relatively low, the amount of time that you're on public transit is short, and the economic value is very powerful. And many of those factors can be mitigated, so the net impact is very good, replacing mitigation with social distancing. But the bigger factor is fear. So people make decisions not based on health science, but on their emotions. And we in the transit industry face the same problem the restaurant industry faces. And ultimately, the real problem that cities will face is not about density. It is about the degree to which we can bring joy back to cities and conviviality. You know, cities thrive because of what happens on the street and in restaurants and bars and meeting strangers on the street and casual flirtation. That is what needs to come back in order for cities to be able to thrive. And that requires bringing joy back in order to counter the fear. And that's where I think we're going to have to see a lot of creativity. And fortunately, cities are hotbeds of creativity. And that's what we're looking for, leadership from largely the business community that makes money off of joy, to set the standards for us that we will follow.
Jeff, I love that. And I'll follow up just quickly. I think you're right on. Three things. For the staff, especially the frontline staff, the question of how do we support them and make them feel comfortable. I think the first thing that we've tried really hard to do, our staff and our fantastic board, and I failed to mention the incomparable Janice Lee and Bevan Duffy, who represent San Francisco, your district, who I love so much, who I get to serve with on the board. But our senior staff and many members of our board have taken it extremely seriously. You can't ask frontline workers to go out every single day and risk their lives to serve and wage a war on them in the boardroom. I think that that's inconceivable. So supporting the staff and listening to them and ensuring that we're in consistent conversations about labor. So often low-wage workers or working class workers are not heard and not seen, not just in transit, but in service spaces, in the service sector. And we know the most important thing that we can do to keep our transportation system alive is not just fund it, but make sure the people who are trained, very sophisticated training to operate those systems, have everything that they need and get the respect that they deserve in this time period. I personally, in this moment, wouldn't even entertain questions about furloughs or about pay cuts. Our workers are the most important part of our system. If they say we're off the line, we don't go anywhere. So that's one, listening to workers. The second piece for me, which I've been watching in awe, the BART communications team believes As important as the train operators are, our communications folks and our technology folks are extremely important in this moment. Every single day on our website, on our app, we're providing updates that are consistent with what we're doing inside of our system, what's changing, what's not changing. We're trying to make sure that riders don't have to guess how to get on the trains, where, and if we have a station closure on one side because we're trying to make sure the station is clean and safe, that folks know. So there's signs throughout our stations in ways that I've never seen them before, educating folks about cleanliness. We have new, if you're on our trains, you'll hear the new announcements, and we have service staff who have been redeployed throughout the system to make sure that folks are using their masks. Is it perfect every single day? No, but damn sure we're trying to make sure that the riders who are riding, they see a different deployment of staff. Our stations are extremely clean, and we're looking at the newest technologies around the world around sanitation and trying to figure out in our next budget year, while we'll be hit drastically, we right now have a potential opportunity to think about increasing hell or high water, our cleaning by 75 million a year. It's what the riders are asking for. And I think lastly, it's communicating, as was said earlier, with other transit systems to make sure not only that we're saying the same thing, but that we're, especially in the Bay Area, our 27 providers, that we're sharing best practices and we're figuring out how to have a multimodal communications to get out the fact that, you know, transit, we're not going anywhere. We could actually be in a really, really strong situation once we're back up and running, and we need to make sure that people know what to do, where to get face coverings, where to wash their hands. But if we can communicate consistently and effectively, I think we'll be in a better position than we were at the beginning of this pandemic.
Great. So one last question. We're a little over, but it's been such an awesome conversation, and we got a lot of questions from the audience. I wish we could answer them all. This is a question for I think probably for mostly Jeff, because Uni has a lot of bus service, and I think a lot of times, you know, I think there's concern. I hope everyone can hear me. My Wi-Fi is sort of acting up, so hopefully you can all hear me. Okay, I'll assume you can hear me. That there's concern that as Muni or other transit systems come out of this, that there will be a contraction of service and a focus on the highest ridership lines, and the lower ridership lines will be axed. And we got a question, for example, about the 48 in Noe Valley, but this could be true in any transit system. Can you talk a little bit about that, about what people should expect in terms of Muni in particular, changes to the bus service, whether people should be concerned that we're going to lose some of these lower ridership lines that are lifelines for the people who rely on them?
So that's a great question, and one that we're struggling with internally as an agency. So as you know, we took 70 odd lines and stripped it down to 13. We've brought a couple back in the last couple of weeks. And we know that it will be years before we have the financial base that we had just 3 months ago. So that means we're going to have to make some tough choices about how we bring service back and what the values are that we apply and the analysis that we apply for making those tough decisions. One of the most important factors that we've used from the very beginning is equity. Making sure that people who have the fewest choices and people who have the least access to basic services, whether that's food or employment, are prioritized. So one of the very first lines that we brought back was also one of our lowest ridership lines, the 54, that runs through a series of mostly low income, extremely diverse neighborhoods, but it serves a lot of communities that are far from basic services and far from rapid transit. It was actually our first choice of lines to be brought back because of its critical equity function. One of the things, though, that we are going to need to make tough choices about is for parts of the city where the system that we inherited comes from 3 private competing streetcar franchise operators from 1910. that are running on parallel streets. Do we consolidate any, some of those lines? Do we ask folks to walk an extra block to a higher frequency line? Or do we ask people to walk one block to lines that are less frequent and less reliable? That will likely be the biggest choice that we have to make. And it's a policy choice, and it's one that we'll need to have a very high level conversation about. But again, a conversation that is rooted in our values and that uses data to quantify what we mean by our values so that our policymakers can make that tough call.
Great. I don't know if anyone else, LA, obviously has a massive bus system. Is now, I don't know if Tamika or Alyssa, you want to just comment on what's happening with bus service in LA, because it is so easy for it to be impacted.
There was something cool announced yesterday by the Metro Board. We have a coronavirus task force, and they said they would fast track bus lanes for that reason, to keep people on the buses for a shorter amount of time and make sure that the buses are coming frequently, just what Mike was speaking about earlier, and Jeff. So this idea that we can protect people and keep everything moving quickly through our cities, and also make sure it's reliable enough that people don't have to wait or may not have to, need the trip planner to know when it's coming.
Yeah, I think that's definitely the biggest thing. What are the things we can focus on, and what are the things we can do? And so those bus rapid transit lanes are really generating a lot of excitement in LA, things people have been asking for a long time that hopefully they can get now. And then I think the other big thing we're just talking about, that we've all talked about here, is the importance of using data. But I think Jeff said it best, data that's based in values, because at the end of the day, those data points are about people and decisions and things, right? And so we can get carried away with only thinking certain people are experts, only thinking certain data points matter. And what's really important is that you set up that system, you set up that process, but you still allow folks to have that conversation, so that it's not just outputs coming out of a formula, it's actual people still being and informing those decisions. And that's all about values.
Great. And I lied. One more final question for Mike. We did get a question about, California, the Bay Area, and Southern California. We have so much brilliance around technology. So many people who are just, we're in the heart of it. How do we harness that brilliance and that reservoir of talent to try to make improvements in how we get around? How do we do that?
I think it goes back to one of the earlier things we said about data standards, because there was this big explosion about 10 years ago or so when data standards for transit came out. What that did is it enabled people, like in their living room, to create a new smartphone application that would provide information in new and interesting ways. And so now some of those like kind of home projects have morphed into businesses, and there's Transit app, which is all over the United States. And there's other big companies now that have come out of just open data standards. And so I think the thing we want to do is enable many people besides us to create new ideas, new things, and to be able to implement them. And a key way of doing that is by making sure that there's standards. And so that way the individuals don't have to worry about the nitty-gritty standards. Those will already exist. Instead, they can be creative and they can create new things.
We should probably also avoid monopolies. Someone actually messaged me, Alyssa, you mentioned about Jump Bike going away. And apparently Jump Bike left San Francisco after, I think, Lyft filed a lawsuit because there was that whole like Ford Go Bike that it was a whole, yeah. So we need to make sure we have a lot of players in the field. Anyone else want to comment on that? Okay. Wonderful. Well, thank you so much, everyone. This was really, really amazing. We had like 1,300 people sign up for this through the website for this. A lot of energy and excitement around this, and you all are amazing. And thank you for bringing your experience and perspective. And thank you again to Spur for helping out, and to Swiftly for partnering on this. And so, Mike, I'll give you the last word on behalf of Swiftly.
So I read this interesting report today from NACTO. For all you transit wonks out there, NACTO is this important organization that helps us do planning for transit and walking and biking. And the statement was, act now and adapt over time.
Yeah.
That's what we need to do. We need to act now and then adapt over time.
Amen.
Amen.
Well, thank you so much, everyone. Thank you, thank you, thank you. Bay Area, LA, everyone, we're all together. We'll get through this. It's all going to be good, and we're going to have great, awesome transit for everyone. So have a wonderful evening, everyone. Thank you to everyone who joined us. Thank you.
Thank you.
Bye-bye.
Bye, folks.
Bye.